today, but I had a tough weekend.
Oh, you're not well?
Ginger, Hintia, Prepre.
You even sound like a ghost.
Yeah, I sound a bit nasal, so
yeah.
Today our listeners will have to forgive me.
Oh, but your doctor is here and you are not feeling well, and you've not come to the consulting room.
Oh, my native doctor just arrived, Philip. But today he's wearing black, so I don't trust the native medicine.
You don't need a native doctor. In fact, today I will let the Joy FM listener be your doctor.
Hey, Kwabi.
Guys. No, yeah. You've always been our doctor. So today, allow us to also take care of you.
Somebody gave me Hintia, Pepper.
Yeah, we have not prescribed that. If you are listening in, doc, please, if you are listening in, I need you to WhatsApp us 05511119997. Doctor is coming to tell us his symptoms.
Sore throat, cough,
sore throat,
running nose,
cough, running nose,
and then small headache.
Your left, is it the left side or the right side? Because I know if the
middle
is the middle. Oh, you just need a loo.
A man day, the one for management member, our blasters.
Oh,
a man day, the one for management member, our blasters. They are listening.
Make you no fear. Listen, we got this. We are going to make sure you are okay.
Okay.
So, Osafo, you've heard Doc and his symptoms.
And then what I've already taken too.
What have you taken?
It's my Hintia, pepper, ginger.
Oh, those ones.
So they shouldn't say that those ones. We don't want those ones.
Those ones won't work. Because me, if I look at the symptoms you are saying, we fufu and goat soup, light soup should fix this.
I will go soup. Oh, okay. I like the prescription here. It sounds very much like what Philip would do with the native doctor thing. So you are getting close. So listeners, please, you should follow Lexus's lead.
They also add suggestions. I've just activated the phone line.
They can. I'm sure guys, they can add things to it.
Let's help the doctor. Our doctor is not feeling. Our doctor needs a doctor. So you and I will have to find a way to help him. But anyway, we move on to what we get to talk about today.
Yes,
because there are certain things that we need you to clarify.
Right.
Today we decided to have a look at patients' responsibilities and rights.
Absolutely.
Yeah, and it's become very essential that we have these conversations around this time, isn't it?
Absolutely. And Kwame, today we're not going to talk about a particular disease entity, but rather we are going to also look at some of the things that come together nicely to enable healthcare service to be rendered in a manner that gives us the outcomes that we all desire. So a lot of different things come into play. You would look at things like the infrastructure. You would also look at payment mechanisms. But then we also understand that the relationship between healthcare professionals and the customers, in this case the patients, is also very vital, and also I'll say by extension by the patient's relatives are of vital in yielding the kind of outcomes that we want. So this is what the patient's charter is about. Okay. So many countries do have it. It's a document that will clearly outline rights and responsibilities. So while you know that these two things always go together,
right?
You cannot exercise a right without a responsibility. It is not ethically right for you always to be banging on about my right. I have a right to do this. I have the right to do that, without talking about responsibility. So this document ties these two different concepts together nicely.
Okay.
Initially, when we started off, they came out as guidelines. To direct how healthcare professionals and patients and their families, will do things. but they're no longer guidelines because advice, if you like, you take it. But a law, there's enforcement, or there's always the threat of punishment if you do not enforce it or if you do not apply it. So fast forward 2012, the Public Health Act of Ghana was enacted, and in that Public Health Act you would have a section that talks about the patient's charter and outlines the patient's responsibilities and the patient's right. So Kwame, there's a legal backing to what we are going to discuss today. And when we open the phone lines, hopefully next week, when we do the open clinic, where I would like people to discuss with us the different challenges or how they see this thing happening in practice. Everybody should be mindful of the fact that this is backed by law.
Okay, well, that's really essential, and it's important that we all know this for effective healthcare delivery.
Absolutely.
I think it helps if the patient knows their responsibilities,
right,
to be able to help their medical practitioners also discharge their duties effectively. Isn't
Absolutely.
It? Yeah.
You know, hand in glove.
Okay. So
we're going to start with the patient's responsibilities, and then hopefully next week, because it's quite a number, and we're going to go into them into great detail.
Okay.
So next week too, hopefully we'll do the patient's rights,
okay,
and then we will take we'll interact with our audience.
Okay. Well, there you go. So I'm going to read out the patient's responsibilities as captured here.
Right.
And
so let's take the first one,
and
then I would explain.
Yeah, if you're listening in, you need to really pay attention because this is very critical. Okay, this is very important. It's important that you know these very well. So first of all, the patient should understand that he or she is responsible for his or her own health and should therefore cooperate fully with healthcare providers.
Right. So that's the general preamble that we give, under the section of the patient responsibilities, that you are responsible, all right, for your own health. Dr. Osafo is not responsible for Alexis Bill's health. You are ultimately responsible for your own health. So that's the general preamble. So let's start with responsibility number 1.
So the patient is responsible for providing full and accurate medical history for his or her diagnosis, treatment, counseling, and rehabilitation purposes.
Right. So when we talk about medical history, it is always that Q&A session, and we do it formally and we do it informally. So you would call me on the phone and then you tell me that, look, them about tennis, after one particular swing, then I felt some pain in my lower back or my upper back. Then I'll ask you a series of questions later on, immediately, how did the pain progress? What did you do immediately after? Did you stop playing? Did you continue playing? So we've got a certain structure, a set of questions that we usually will follow. So we call it a structured history taking.
Okay.
So the doctor or the healthcare professional will do that Q&A session. Sometimes, unfortunately, patients or their relatives don't quite understand this particular responsibility. They think that once they tell you the first line, that's it, start giving me some injection or start doing something, because other than that, why are you asking me all these questions? You are asking me all of these unnecessary questions about whether I have diabetes or I have asthma. What does asthma got to do with my back? Well, your past medical history is very important to the doctor, because if you have back pain, for example, and Kwame, I'm going to give you, or I'm contemplating giving you a non-steroidal anti-inflammatory drug like ibuprofen or diclofenac for the pain. If you have a history of asthma and I'm not aware, or you don't declare that, or I don't ask about that, I may trigger an asthmatic attack, and that wouldn't be too good for you. So your responsibility as a patient is to provide full and accurate medical history. Sometimes we go into areas that make people feel a bit uncomfortable. You may come to me and say, okay, you've got some pain down there or in your penis when you pee, then I would probably want to know whether or not you are sexually active. But then your public status image that you project out there, that question then makes it a bit uncomfortable. We'll ask questions about your social history, whether or not you smoke, whether you've ever smoked, and what did you smoke. Go into all of those things. And that is why it says you have to provide full and accurate. That means very, very important, full and accurate medical history. And this is the reason.
Okay.
Number 2.
Now, the patient is responsible for requesting additional information and or clarification regarding his or her health or treatment, which may not have been well understood.
Right. Requesting. Quite time and again, I have heard this, especially when I'm taking a history from a patient who's gone, or healthcare at another facility before probably coming to us. Doctor, I don't know, said the end of the year, last week, I can't hear me. He just wrote medicine for me. Doctor said nothing, nurse said nothing, pharmacist said nothing, all healthcare professionals said nothing. That I told the doctor my complaints and he just prescribed medications for me. We've repeated it over and over. It almost appears to be the standard. Well, it is the doctor's responsibility, all right, or the healthcare professional's responsibility to always inform you about the diagnosis. However, we are seeing today that when you flip it the other way too, then it is your responsibility as a patient or a relative of the patient accompanying the patient to request additional information and or clarification regarding your diagnosis, the treatment plan or the care plan, which you either may not have understood well or may not have even been discussed. So I always empower my patients. I tell them, once the doctor goes through a Q&A session with you, once the doctor does a physical examination, that is the point where if he doesn't tell you what he's thinking about, that is when respectfully you should also request.
Okay.
So responsibility both ways, healthcare professional and then the patient. 3.
All right. Now, the patient is responsible for complying with prescribed treatment, reporting adverse effects, and adhering to follow-up requests.
I would say we're guilty.
Your line is breaking.
Hello. There be your line there breaking. Comply with prescribed treatment.
Their network is not well. It's not doing well.
Everywhere you go. Some people say that everywhere, even including this place. Kwame, comply with prescribed treatment. Today I saw a teenager I see, she's also from McGee's. She'd been given antibiotics from last week Wednesday, and I saw the box and almost everything was in except one blister pack had been open. Doctor, I took one and then I stopped. I didn't like the way it was making me feel. I thought I would get better. This is exactly what point 3 is about. Okay. You need to comply with treatment, but however, we also admit that sometimes drugs may produce adverse effects, and again, it is your responsibility to report the adverse effects. When you come into the hospitals, the FDA actually provides us an adverse drug reporting form. It's a yellow form, all right, that we put all such complaints on and send to the FDA for what they call the post-market surveillance. So if you don't tell us about the drug and you just blanketly assume that, as for this hospital or this clinic, you don't mind them, their drugs are not good, when I took it that happened. But if you put down something as an adverse effect in Accra or Ashalibuche, and then another person also puts down the same thing in Mampong, and then in Kumasi and in the Lubu, then the FDA then gets a certain sense of what is going on about a particular drug. So please, let's take this complying with the prescribed treatment and reporting adverse effects seriously.
I know people who always say, I don't like medicines, so I don't like medicines.
Yeah, so it will take 1 or 2 and then stop.
Yeah.
And it all contributes to challenges like resistance to medicines, particularly antibiotics. All right, such that later on when you want to use the antibiotic, it doesn't work. All right, multi-drug resistant. We did the same thing with chloroquine. Chloroquine is a beautiful example of what we're talking about. That we abused chloroquine so much, it got to a point 25% of all patients who took chloroquine would not get any response, and that is why we had to switch.
Okay, so the patient is responsible for informing his or her healthcare providers of any anticipated problems in following prescribed treatment or advice.
Right. So it's a shared care plan. So I always want to find out, is this something you can do? All right, especially with my the patients who have diabetes, who come to the clinic. Dietary management is absolutely important. So if you go and start with a dietary regime that it's almost impossible for the person to comply with, because they may not be the ones preparing their meals, or the choice of what you want them to eat is not readily available, then it becomes a problem. So we know that there may be challenges following the prescribed treatment or a prescribed advice. If you know as a patient or as a relative of the patient that there are some challenges based on the care plan that we have developed, kindly share it with us.
Okay. Well, the patient is also responsible for obtaining all necessary information which have a bearing on his or her management and training and treatment, including all financial implications.
Right. So, I'll be very honest and tell you that in the last 10 years, we've had a few instances where we clash heads with patients and their relatives. And I always tell my staff that the patient is right. You have to inform them of the financial implications of every treatment. All right, even if they are insurance, there are different types of insurance. You've got a national health insurance. You've also got private health insurance. And Kwame, you know about the private health insurance. There are different packages. All right, somebody's on platinum, somebody's on bronze, silver, and it will cover certain things, but it will not cover everything. All right, and therefore, whenever you develop a care plan, you have to let the patients know about the financial implications.
Okay.
But if we don't also, then you, the patient, you should know that there's no free lunch. If they say they're going to do something for you, Bachane boy is saying, think about the supermarket. When you go to the supermarket, everything has been labeled. So you pick something off the shelf, you already know. Let's take the same mindset to the hospital. How much will it cost for my consultation? How much will it cost for these labs? How much will it cost for the MRI? You know this ahead of time so that they don't surprise you at the end of the day.
Okay. Now, the patient is responsible for acquiring knowledge on preventive, promotive, and simple curative practices, and where necessary, to seeking early professional help.
Kwame, the last bit is my biggest challenge. Our health-seeking attitudes in Ghana is not where it ought to be. It needs to be better. All right, seeking early professional help when necessary. All right, it is your responsibility, all of us, in acquiring knowledge on simple preventive, promotive tips. Health promotive tips. So Kwame, that is what we do here on this show, and we've done it for 8 years plus.
Right.
All right. All you need to do is to tune in at 4:30 on Wednesday, and voila, it's there. You can just pick up all the information, the early warning signs, so you know when to seek healthcare. So please, let's read a bit. When you go on to the social media, it's not always the Shatawale and GFA and Asna and Green Beans and Manu, that kind of thing. But spend some time, go onto the medical's, social media pages and acquire some health information, empower you so that you can take active decisions regarding your health.
All right, that's great. The patient is also responsible for maintaining safe and hygienic environment in order to promote good health.
Yeah, well, I think that one is black and white, straightforward. Let's hit the next one.
The patient is responsible for respecting the rights of other patients and clients and health service personnel.
Oh, yes. Kwame, it does happen that sometimes we go to the hospital or any health facility, you may not be happy with one thing or the other. Please, whenever you're not happy with anything going on, either with your care or with the care of a friend you are accompanying or a member of your family, Kwame, remember that if you shout, it affects other patients. You're not respecting their rights. If you cause fear and panic, all right, for the nurse, for the doctors, for the healthcare professionals who are the ones going to be attending to your family member or all the other patients, how is a nurse who has a lot of fear? How is a nurse who has a lot of anger in her at that moment? That person is then dangerous. And we don't have a luxury of calling backup nurses or doctors who already the numbers. So please, we have grievance procedures. All right, dispute resolution procedures. All institutions have them. So Kwame, you know Mampo, if you come to Mampo, you see these little notices all around the place. Compliments, complaints, and suggestions. Contact the quality manager. The WhatsApp number is there. The phone number is there. And we make it easy for people to lodge their grievances.
Okay.
All right.
Okay.
So please, anytime you have a grievance, anytime you are not happy, just know that you still have to respect the rights of the healthcare workers. You don't exercise your right by abusing the right of others.
Right. The patient is also responsible for protecting the property of the health facility.
Kwame, that's why let me say something here. I don't like it when they pour leftover food in the sink. They should stop it.
They've been doing that?
Rice.
They pour leftover food in the sink?
Yes.
For what?
Plumbing is the most expensive recurrent expenditure I have. Also always joke. No, you give me some kind of other kind of expenditure. I'm just tired of that particular one.
Are you serious?
Oh yes.
This is the first time I'm hearing that.
Oh.
They pour rice in the sink.
Yes. Leftover food, they just clear everything into the sink, and there's a sink in each of our wards. You know, even the shared ones. You know, so it's just
then they open the tap. So
yes. He's washing the plate or bowl or something into it. There are waste bins and all of that. So this is just to exemplify that last point and to state that once you are using the health facility, please bear in mind that you have to leave it in good condition so that another patient can also use it.
Right.
It's as simple as that.
No, that's
So
important.
Kwame,
Yeah. So that's actually
these are the 9 responsibilities under the law that all of us, tomorrow when I'm a patient, or even today I'm a patient.
Today you're a patient.
Just that I'm not in the hospital, the general public.
You should see the remedies that people have sent in. I'll read some for you.
Right.
Yeah.
So we should all be reminded of these. If you go online, just look for the Public Health Act and put in the Patients Charter of Ghana. Please, it will come up.
Yeah.
Educate yourself. I'll put this on our social media platform. Next week, we will try and look at the patient rights.
All right, there you go. Well, my fellow doctors, the drive time doctors who are listening right now, they have sent in lots of remedies. And I think you would like this. Cyril from Pillar 2. For the purposes of this conversation, we call him Dr. Cyril. Dr. Cyril says, Lexus, doctor needs para, vitamin C, cough mixture, and a hot
that thing. O-P-G-P-S-P-R. Okay. Kwame, some formula also, I agree. Dr. Cyril, please call me after the show.
You agree?
Kwame, the Akari is okay. The rest, you give it to Philip. The rest of the medicine, this is there. Then they say
Angie in Apollonia says, doctor needs some ginger powder mixed with warm water and also rest. Okay.
Well, they are professional. The first one is more like the native doctor.
You like the first
the
one?
native doctor advice. You see,
this doctor. Prince Itemawe says 3 days of absolute bed rest, hot meals to be served in bed.
This one is getting close to the first one, because after the hot meal in bed, then another hot something. Oh, Karen. Hot. That's good.
Lexus, Dr. Osafo's treatment. Number 1, 3 shots of local antibiotics, mixture in original akpet
from the Volta region, 3 glasses Hey.
1 bowl of hot pepper soup with unpeeled herrings.
Hey.
After 3 hours,
Hey.
Honorable Mrs. Dr. Asafo shall give him 6
6 points. Ah, Kwame. Yeah. Kwame. This show is good. I thank all the wonderful listeners. Oh, I can see how much I am loved. By this time, she's also listening. So as I'm driving, I'm getting home.
Then she's
I hope that they prepare the hot meals.
Doc, it's okay.
Oh, it's okay.
It's okay. You will get well. Don't worry.
I'll get.
For those who want to get in touch with you,
No, I don't want to get well. The number is 0501 477 340. Those who want to come by too can come to number 10 Kincho Street, East Legon Hills branch. On WhatsApp, the number is 0501 477 340. And Kwame, I have a birthday shout out for my head of OPD at Mount Paul.
Okay.
Yeah, I call her Abna Karu. It was a birthday yesterday. Happy birthday, Abna. You worked very hard.
All right. Happy birthday, Abuna. I'm grateful, Doc. We're grateful that you came by today. Okay.
Yeah, so I'll see you next week.
All right, and get well soon, sir.
Oh, I'm well already.
Man. This is Drive Time on Joy, 5 o'clock. We'll find out what's happening in news shortly.